20 years ago, no one ever would have foreseen what the Health Foundation would turn into. I think that's probably the most amazing piece, is that the original, with the sale of Providence and the creation of the foundation, what or where that would be 20 years later, I don't think anybody could have imagined that, except maybe one person, except maybe Myrna.
Providence made this happen, or Tenet made it happen by buying out Providence. I think that the board of directors at that time, led by people like Bob Hoy and Woody Hunt and Bob Scove, and that group of individuals, Adair Margot was involved in that. And I think they did the proper planning to begin with.
I was a board member of Providence Hospital at the time that we had the business leadership that on the board looked at what we saw the realities of our competitive position, where we had the two largest health hospital chains in the United States that were our competitors, that both had access to capital markets that we did not have, and access to really the leadership, the human capital that we did not have through their nationwide networks. And so we had to make a very difficult decision that this was not a competitive circumstance that we were going to be successful in. We did not want to put at risk the resources that had been accumulated over a very long period of time by our largest nonprofit hospital, and really the original big hospital that we had been developed in the community. So that led to a decision to really compete those two entities together to maximize the value that could go into what was to become the largest charitable entity in the region.
Everybody has needs, and they have stories to tell, and it's trying to sort those out and decide who can deliver within the parameters of what the foundation's trying to accomplish.
It's smoking, the smoking ordinances, or the change in the smoking ordinance. The work that's been done for obesity, Walk El Paso Walk. I mean, if you rolled out names and attached the Health Foundation, which some people will or will not realize they were behind that, those are the accomplishments that will last for generations. A lot of the focus on healthy eating, and getting kids to start identifying those things early in life. Those are the long-lasting effects of the Health Foundation.
A day that I don't smoke is like a year of life to me. Paso del Norte helped me save my life.
My date was August 19th, 2012. Helped me to take that last step towards a positive change for my health. And so I gave up smoking cold turkey, and haven't even thought about it since.
Well, that's one of the reasons we've set up two new foundations, is to basically try to increase our funding capacity. $220 million, which is what we have now, Chris, is a lot of money, but it's not enough to do what needs to be done in this region.
This is a vision that we all have shared for many, many years, to continue with the same programs that we have, but also to enlarge that capacity with more donations, with more programs, with more leadership, and to be present, so the people in Juarez can see us and can touch what the foundation is doing.
I envision that in 15 or 20 years, this foundation will have $500 million. And the foundation in Juarez will give. The new PdN Foundation will certainly raise a lot of money. They've been very successful so far. So once we have and really can grant that much money, and then use some of that money to do leadership activities like Realize and other types of activities, I think the foundation has a very, very bright future.
This organization has got such incredible skill and really in passion, I think, from the ground up. When you walk through the offices, you just see that there's focus on the mission and what the work is to be done.
It's really a design by El Pasoans focusing on the community, and it's the Health Foundation has taken it a step further than it being just about El Paso, but about it being about the region. That it is cross-border.
An organization that clearly is seen as no borders, that has no nationality, that has no differences between one community and another.
What an opportunity. And can we do this right? You know, we must do this right. And so it puts a tremendous amount of responsibility, I think, on the staff and the board to make sure that what we do is measurable and that it's right.